We are talking today about injectable safety. There's lots of people out there offering injectable services, whether it's in their home, at a Botox party, in a hair salon. Everyone seems to think that it's easy to inject people's faces. What Angela and I want to talk to you about today is the safety of injectables. It's important to remember that these are medications. They have drug identification numbers, they are controlled access, and they can only be sold to physicians. So the first question you need to ask if you're allowing someone to inject these drugs into your face is, who is your doctor? Where is your doctor? Has your doctor actually seen you? Have they assessed you? Have they checked out your dosing and your placement? Who's supervising this? And where did this drug come from? There are counterfeit injectables out there, so you want to make sure you know who your doctor is, you know what drug you're getting, and you know where it came from. Where are you? These are drugs. They need to be administered in a medical facility. So look around you. Do you have appropriate hand washing sinks? Do you have an appropriate drug fridge where the medications have been stored properly, where the temperature is being monitored? These medications are temperature sensitive. If they're not stored properly and the temperature isn't monitored, they can easily become either contaminated or deactivated. So you need to make sure you're in a medical facility, the drugs are properly stored, and in the same note, they're being properly reconstituted. They come in a powdered form, and they need to be mixed before they can be administered. So where are those drugs being mixed, and who's mixing them? What are they being mixed with? You can't have cross-contamination. It needs to be done sterilely in a medical facility. And any medication has the potential for an allergic reaction. That's any drug. So where are you? Again, are you in a medical facility? Are the people around you capable of handling an allergic reaction? It's really, really uncommon to happen, but it could happen, and that's potentially life-threatening. So who's around you? What's in the facility? Can they handle that if that happened? Angela is an RN. She's working on her master's degree in nursing. She has her operating room certificate and is a clinical nurse educator. She is unflappable in the event of an emergency. I'm a plastic surgeon. I have all of my resuscitation certificates, and we are fully capable of handling any possible emergency that can happen in this facility. Is there an emergency card available to you? Is there oxygen? Is there epinephrine? Are all the drugs available? They're not available in hair salons. They're not available in someone's basement. So this comes down to safety and being in a medical facility with medically trained individuals administering these drugs. Who's going to do your follow-up? So there's lots of people that want to drop into Kingston for one day, throw some drugs into your face at a really great deal, and then take off again. It's a medication. We need to adjust the doses, and you need to have appropriate follow-up. So we're going to see Ange back in about 2 weeks' time to check her dosing, check her placement, and see how things are going. So if this person's just dropping into Kingston for a day, who's going to do your follow-up? Who's going to see you back if you have a problem? In the rare event that you have an infection, who's going to deal with that? A summary on injectable safety. Make sure you know where you are, who you're with, and that you're going to have appropriate follow-up for your procedures.